Engkau bagai air yang jernih di dalam bekas yang berdebu. Zahirnya kotoran itu terlihat.
Ladies and gentlemen, before we start, kindly I remind all of the participants to fill in the e-certificate for this event at the end of the ceremony. Thank you. Our event will start in a short time. Please help yourself. Bismillahirrahmanirrahim. Berlibur ke kota setelah sarapan bubur dengan Mbak Rita. Sungguh gembira hati bisa berkenalan, banyak teman, banyak saudara. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam serumpun, and a very good afternoon to all professors, doctors, lecturers, and participants. In Malaysia and Indonesia, we say, tak kenal maka tak cinta. Thus, I am honored to introduce myself. My name is Ku Muhammad Shakir bin Ku Ahmad, a final year student of audiology in University of Science Malaysia, USM, and I will guide you to the afternoon session of our event. And first of all, I would like to give full gratitude to all participants who are still held on to this ceremony until now. Tons of knowledge were given by experienced panelists, keynote speakers, in which we hope that the sharing will benefit us in the future, inshallah. Before we continue, let us take a glimpse look of video of our corporate partners. Please welcome.
Hi, I'm Angeline, and I'm 25 years old this year. I am a CATS accountant, and I received my cochlear implant when I was 4 years old. When I first learned about Kenzo 2, I was looking forward to the off-the-ear wearing option and direct streaming features. When I work from home and need to attend the meetings virtually, the direct streaming features enable me to hear my colleagues clearly, and I was able to engage and participate better. I also love the fact that I can now take calls seamlessly with Kenzo 2. It makes communication with my loved ones at home and overseas so much easier. I also enjoy listening to music through my phone now. This was not possible before, and it was mind-blowing. A key highlight of Kenzo 2 was that it hides well under my hair. As a child, I was always conscious about how others see me with my sound processor, and I use all means to hide it under my hair. With Kenzo 2, I can now easily tie my hair up in a ponytail, and it definitely boosts my confidence.
Ladies and gentlemen, first of all, I would like to welcome all of you to our afternoon session. And for our afternoon session, we will divide our afternoon session into 2 rooms. And each room consists of experienced panelists from different professions. For room 1, we will focus on hearing, shared by Dr. Wan Najibah Wan Muhammad, Madam Au Chiu Lee, and Dr. Muhammad Fazil Nur Rashid, doctors and expertise from hearing care from University of Science Malaysia. For room 2, we will emphasize on education and psychology, shared by Prof. David Evan, Dr. Elga Andriana, and Dr. Shamsinar Abdul Jabbar, expertise in education and psychology from Universitas Gajah Mada and University Pendidikan Sultan Idris. For participants, you may choose to join any of the rooms you interest of. For participants who join through Zoom meeting, you can enter respective room by clicking the breakout icon at the bottom of the page and choose your interest room. And for participants who join through YouTube, YouTube link is provided for respective room in the live chat. Thus, by clicking the link, you can join through your respective room. Again, I repeat, for participants who join through Zoom meeting, you can enter your respective room by clicking the breakout room, the breakout icon on the bottom of the page, and choose your interest room. And for participants who join through YouTube, YouTube link is provided for respective room in the live chat. Thus, by clicking in the link, you can join through the respective room. Okay, and we will start our respective room session in a moment. Now, participants can join the respective room. Thank you.
Welcome to the first room dedicated to discuss about hearing. My name is Nur Shahira, a final year student of audiology in University Science Malaysia, and I will be your host for this evening. Before we start our session, I would like to inform that there will be a Q&A session after every talk. Participants may write their questions in the chat box for the speaker to answer. Now, to kick off our evening session, I would like to invite our first speaker, Dr. Wan Najibah Wan Muhammad, to give extensive thoughts on fixing future communication from a hearing perspective. Wan Najibah binti Wan Muhammad is a senior lecturer and clinical audiologist at the School of Health Sciences, University Science Malaysia, Malaysia. Prior to joining the university, she worked as a clinical audiologist at a private hospital in Kuala Lumpur. Her educational background started after completing a bachelor's degree in audiology from University Kebangsaan Malaysia. She then gained her master's degree in clinical audiology from the University of Flinders, Australia, and PhD tinnitus from the University of Nottingham, United Kingdom. Upon graduating from doctoral degree, she had worked as a part-time research fellow at the NIHR, Nottingham Hearing Biomedical Research Centre, University of Nottingham. She has been actively involved in many research projects, particularly tinnitus studies. As a lecturer, she teaches many academic courses covering both fundamental and clinical aspects of audiology. She is also involved in the supervision of various research projects at undergraduate and postgraduate level. Along with her clinical practice as an audiologist, she has been extensively involved in clinical teachings for adults and pediatric clinic. She was also appointed as a supervisor for subject matter expert SME in audiology rehabilitation tinnitus by the Allied Health Science Division, Ministry of Health Malaysia. Enough being said, let's hear it from Dr. Wan Najibah.
Thank you to the chairperson. Assalamualaikum and good afternoon, ladies and gentlemen. My name is Wan Najibah. In celebrating World Hearing Day, I would like to share with you regarding hearing awareness. My topic today is fixing future communication in hearing perspective. When I look at this picture, it reflects my experience when I communicate with my father. He passed away 3 years ago. At that time, he was 84 years old. He has moderate sensory neural hearing loss in both ears, and at the end, he was fitted with hearing aids. My father has communication difficulties from time to time. He had hard time understanding what I was saying, especially when I was in a hurry or when I communicate in the presence of noise. I realized sometimes my father was unhappy when we are laughing, talking, but he couldn't participate. Then I realized hearing is beyond than what we thought. It is about to communicate our thoughts and also our feeling. I believe this experience is not uncommon. Maybe some of you are here had same experience with me. Especially when we look at this data, the data show that 1 in every 5 people around the world are affected by hearing loss in 2019. Surprisingly, by 2050, this number will have increased to 1 in every 4 people around the world will have hearing loss. In terms of newborn babies, 1 to 3 in every 1,000 live births have been reported with hearing loss. Meanwhile, when we look at the school-age children, hearing loss has been reported in 5 out of every 1,000 school-age children by parents. In Malaysia, is about 4,072 children with hearing loss are registered in government hospital. This data I got from Ministry of Education Malaysia. When we look at this data as a parents, what we will do? Do we will take action or we just look at data as a data? But as an audiologist, which is a healthcare professional who assess and manage people with hearing loss, what do you think about this data? What should we do to manage those with hearing loss? What type of appropriate intervention to give to these people to improve their communication? Meanwhile, as a government or international organization, for example, WHO, World Health Organization, what should they do to increase awareness about this importance of hearing, good hearing, and as a result to improve communication? Could be celebrating World Hearing Day annually as we do today. Before I explain what is hearing loss, I would like to share with you about the parts of hearing. As you can see here, ear consists of 3 parts, which is external ear, middle ear, and also inner ear. So external ear consists of pinna and external ear canal until the eardrum. Actually, it collects sounds from the environment and channels through external ear canal to the eardrum, cause the eardrum to vibrate. The vibration of eardrum will amplify the sound. The second part of the ear is the middle ear. It starts from eardrum and it has 3 small bones known as ossicles until the over window. The vibration of the ossicles will amplify the sounds. And the last part, which is the inner ear, consists of cochlea, which is the organ of hearing. Cochlea plays important roles to amplify the sound as well as to tell the different type of sounds. For example, sounds for s, or sh. Then the inner ear sends sound to the brain through the 8th nerve. So what is hearing loss? Hearing loss happens when one or more parts of the ear has problem. For example, only middle part of the ear has a problem or combination between middle part and inner part. The presence of problem in different parts of the ear explains different types of hearing loss. There are 3 types of hearing loss, which is conductive hearing loss, sensory neural hearing loss, and also mixed hearing loss. Conductive hearing loss involves problem in the external ear or in the middle ear or combination in both external ear and also middle ear. Meanwhile, sensory neural hearing loss, the problem in the cochlea or cochlear nerve or combination of both cochlea and also cochlear nerve. The third type, which is mixed hearing loss. Mixed hearing loss is a problem in the mixed hearing loss is a combination of conductive and also sensory neural hearing loss. It means that the problem in the middle part and also in the inner part, or in the external part and also in the inner part, or in the external, middle, and also in the inner part. If you can reflect back that my father has moderate sensory neural hearing loss, so it means that my father has problem in the cochlea. Cochlea, which is the function to not only to amplify the sounds, but also to tell the different types of sound. When we talk about hearing loss, we want to know the type of hearing loss and also the degree of hearing loss. I already explained the type of hearing loss. It has 3 types. Now I would like to explain in terms of the degree of hearing loss. When you look at this picture here, known as audiogram, help us to understand not only the degree of hearing loss, but also it explains where and what intensity of the sound that we need in order to hear normal conversation level. Yellow shaded area represent normal conversational level. Horizontal parts represent the type of the sound, For example, S sound is located at high pitch area. Meanwhile, vertical area represent the loudness of the sound. For example, sounds we need the minimum level in order for us to hear sound is around 40 dB. Using this audiogram also, we can tell degree of hearing loss. As you can see here, it has normal range. That means patient doesn't have any hearing problem. It also shows mild hearing loss. Mild hearing loss, that means the minimum level that the person can hear between 25 to 40 dB. Next, you can see moderate hearing loss. Moderate hearing loss, that means the minimum level that the person can hear between 45 to 65. So severe hearing loss, that means the minimum level that the person can hear between 70 to 90 dB HL. And the last one, the worst hearing loss, which is profound hearing loss. The minimum level that the person can hear for profound hearing loss is 95 dB HL and above. Just now I explained it to you the degree of hearing loss. Now I would like to explain it to you what's the consequence when we have different degree of hearing loss. You can see here, so normal hearing, that means person is able to hear all sounds. Meanwhile, mild hearing loss may hear speech sounds, but soft sounds are hard to hear. In terms of moderate hearing loss, difficulty hearing conversational speech even at close distance. Meanwhile, for severe hearing loss, may hear no speech sounds at conventional level and only hear some loud sounds. For the profound hearing loss, patient will not hear any speech sound and only can hear very loud sound. So my father that I share with you has moderate sensory neural hearing loss. That means my father has difficulty hearing conventional speech even at close distance. So in general, I would like to share with you signs of hearing loss. Usually, people with hearing loss often ask partner or people to repeat what they are saying. They also have difficulty understanding words, especially in the presence of noise. They will listen to the music and also watch TV with high volume. They have difficulty hearing on the phone. So, which is, for example, they need extra cues, not only auditory systems, but also visual cues in order to understand communication. So when we reflect in this pandemic area, in this pandemic situation, which is we use masks when we communicate with people. So for those who have hearing loss, they may have difficulty to communicate when we cover our mouth with mask. People with hearing loss also try to avoid social activities. This is because they can't follow the conversation, and they may give responses that are irrelevant to the partners. In order to fix the communication, we need to know the cause of hearing loss. It is either it is treatable or untreatable problem. For those who has been diagnosed with sensory neural hearing loss, usually problem in the cochlear region, this is a permanent hearing loss, means untreatable causes. Usually it is due to aging process, exposed to loud noise, either through occupational or recreational noise. Medication, for certain medications, for example, antibiotic and also chemotherapy can cause of hearing loss. Some illnesses, for example, cytomegalovirus infection, lack of oxygen at the time of birth, severe jaundice in the neonatal period, meningitis can also cause of hearing loss. Children with syndromic, for example, Waardenburg, Treacher Collins are related to hearing loss, and hereditary also can contribute to be the cause of hearing loss. Meanwhile, for those who have been diagnosed with conductive hearing loss, which is the problem in the external ear or in the middle ear or both in external and middle ear, this is usually a treatable problem, means we can do something to resolve or remove the problem and our system will be normal. For example, the presence of earwax. Earwax is located in the external ear canal. So earwax blocks sound travel from the external ear canal to the middle ear. So the sound will have not enough amplification when reaching the middle ear. So what we can do is usually we refer to the GP or to the ENT to look at this management for earwax removal. Another cause of conductive hearing loss is ear infection. It can be otitis externa or otitis media with effusion. Otitis externa is located in the external ear, meanwhile otitis media with effusion is located in the middle ear. Abnormal bone growth also can cause of hearing loss. Tympanic membrane perforation or ruptured eardrum can contribute for hearing loss. Eardrum amplifies the sound from the external ear to the middle ear. So another one is congenital malfunction of the external ear, for example, microtia and atresia. Microtia is the malformation of the ear, which is, for example, stenosis external canal. Meanwhile, atresia is absence or close of the external auditory canal. That means both of these malformations will interrupt the sound travels from the external ear to the middle ear. When we unaddress hearing loss, it gives impact on several areas. For example, communication and speech. Adult with hearing loss affects the ability to understand communication. Hearing loss also can affect child's development of speech and language skills. When a child has difficulty to pick up the sound and to send to the brain, the area of the brain used for communication may not develop appropriately. The impacts of hearing loss also can show on cognition. Cognition will deteriorate. In terms of education and employment, untreated hearing loss may cause problems in speech and language development, as I explained before. It leads to learning problems and resulting in poor school performance. For employment, untreated hearing loss affect communication and tend to have impact on the ability to follow conversation, indirectly can affect job performance. People with hearing loss also tend to avoid social activities. They are afraid that they are unable to anticipate the conversation, or they may give irrelevant responses. And they may get unexpected reaction from friends. Thus, it will cause depression, low self-esteem, or indirectly it will affect emotional factors. I already explained the type of hearing loss, the degree of hearing loss, the causes, the signs, and also the impact of hearing loss. What we need to do is we need to identify as early as possible hearing loss in order for us to have effective management. How do we identify the problem? So we can identify through early identification or also through hearing assessment. Early identification, for example, newborn hearing screening, we can conduct on newborn hearing screening. We also can conduct for those or for patients who receive ototoxic medication, people exposed to the loud noise, and also for preschool children. Meanwhile, for hearing assessment, in order for us to identify hearing loss, usually we conduct in clinical setting. We also can do in community setting. Due to this pandemic, we can use teleaudiology in order to assess hearing loss. How do we manage those with hearing loss in order to fix their communication, especially for those who have permanent hearing loss? As you can see here, hearing aids is one of the solutions. Hearing aid pick up sound from the environment and send to the brain through the external middle ear and also inner ear. My father has been fitted with hearing aid in both ears in order to help him to hear better and improve his communication. Apart from hearing aid, we also have cochlear implants. Usually, cochlear implant we fitted for those who have severe or profound hearing loss. Cochlear implant consists of two parts, which is external and internal parts. External part pick up the sound sent to the internal part by passing the external and the middle ear. The internal part is implanted in the cochlea and receiving the signal sent it to the brain. In terms of management of hearing loss, we also can use hearing assistive technology. For example, hearing FM system. This technology or these hearing assistive devices is used for those who have mild hearing loss, especially for children in the classroom setting. Apart from that, communication strategies also can offer for those who have hearing loss. For example, the way they communicate in the presence of background noise, they use visual cues in order to help them to understand communication. And lastly, which is the least one, is sign communication. We try to avoid those who have hearing loss using sign communication. We try to encourage people with hearing loss to use auditory system to communicate with us. In celebrating World Hearing Day, I hope that my session will be beneficial to all of you. Thank you.
Thank you, Dr. Wan Najibah. Okay, next we will proceed with the Q&A session. So due to time limitation, only one question will be answered. However, don't fret, as our speaker will answer if there is any remaining question in the chat box. So doctor, a question from an audience. Could you explain more about early identification for newborn or infants?
Assalamualaikum and good afternoon to Chairperson Shahira and also all audience. Okay, so as I explained in my slide that one of the early identification through a newborn hearing screening. So we know that early identification of hearing loss is the first step for children to listen and speak. So that's why we emphasize to have a newborn hearing screening program. Nowadays, in the world that we have universal newborn hearing screening, which is we conduct hearing assessment to all babies or newborn before they leave a hospital. Or we can start with high-risk babies first. Okay, for those we think that they have high risk to have hearing loss, so we have to do hearing screening first. I think in the morning session, Associate Professor Dr. Nomani and also Dr. Ayu from UGM also explained about the newborn hearing screening. So we try to detect hearing loss as early as possible, because we know that the children, we have to prepare children with a better hearing in order for them to acquire a language. Okay, thank you.
Thank you, Dr. Wan. That was a very motivating and informative talk. So next, I would like to invite our second speaker of the evening, Madam Au Chuli, to deliver a lecture on an overview of inclusive education for hearing impairment in Malaysia. Au Chuli is a senior lecturer and clinical audiologist at the Audiology Program, School of Health Sciences, University Science Malaysia, USM. Before joining the realm of academic in 2010, she worked as clinical audiologist in Kandang Kerbau Women's and Children's Hospital, Singapore, and also University Science Malaysia from year 2004 to 2009. She had her bachelor's degree of audiology from University Kebangsaan Malaysia, and then gained her Master of Clinical of Audiology from the University of Melbourne, Australia. Currently, she is pursuing her PhD in inclusive education for hearing impairment. Her research interest is mainly in children, especially oral rehabilitation, cochlear implant, and educational audiology. As a lecturer, she teaches courses such as audiology clinical assessments, pediatric audiology, cochlear implants, and etc. Other than that, she has extensive experiences supervising undergraduate audiology students in research projects and clinics for adults and children. Without further ado, I would like to invite Madam Au Chuli to take the stage.
A very good afternoon to all. Thank you for joining me today. So let's work together regarding this topic, an overview of inclusive education for hearing impairment in Malaysia. So we're covering the topic in Malaysia. So inclusive education is an education system that includes all students and welcomes and supports them to learn whoever they are and whatever their abilities or requirements. This means making sure that the teaching and the curriculum, school buildings, classrooms, play areas, transport and toilets are appropriate for all children at all levels. Inclusive education means all children learn together in the same school. So what does it require? It requires non-discrimination, best interest of the children, right of the child to be heard, protection from violence and abuse, opportunity for life within the community, support with mobility, access to healthcare, habitation and rehabilitation. This is part that is relevant to audiology. We are involved in the oral rehabilitation and rehabilitation. With inclusive education, we can promote participation in public life, exercise of legal capacity, work and employment, adequate standard of living for those with disabilities. So let's look at Malaysia's history, the evolution of inclusive education in Malaysia. So these are the acts and regulations that is relevant to the progression from the segregation education to inclusive education in Malaysia. So starting from the Federal Constitution, and in 1996 there's one act and regulations that requires the minister to prepare the special education for those with disabilities. And then more prominent is the one in 2008, whereby Persons with Disabilities Act 2008 stated that persons with disabilities shall not be excluded from the general education system on the basis of disabilities, and children with disabilities shall not be excluded from preschool, primary, secondary and higher education on equal basis with persons with children without disabilities. This is quite prominent change in Malaysia. And next, that will be in 2013, there's another act and regulations. It's called the Special Education Regulation, which replaced the 1996 Act. So here comes the 2019, government has promotes zero reject policy. With this policy, it is to ensure that all children in the country, include those with special needs and undocumented children, will have access to education. This is a big move. So there are 3 education systems in Malaysia that is for special needs children. There are Special Education School, Sekolah Pendidik Khas, Special Education Integrated Program, SEIP, Program Pendidikan Khas Integrasi, Inclusive Education Programs. So generally, for those who want to enroll in inclusive education, students are required to meet criteria set by the Education Ministry Checklist for Inclusion Readiness, SSKI. Others also depends on the parental choice, according to seems like the best for the child and the family situation. The question is what best for the child, and the child's adaptation is 2 different issues. So where are we now in Malaysia? So I have the data for 2020. In Malaysia, there are 14,238 new registration with the Welfare Department under the Person with Disabilities. In Malaysia, in short form, is OKU. So from this total, 448 are children with hearing impairment. That comprise of 3.15% from the total. So others are other disabilities like vision impairment, speech delay, physical disability, learning disability, mental and multiple disability. Okay, so this slide is to show you the Malaysia schooling enrollment of children with disability in general. So all the categories, not just hearing impairment. You can see here, the integration program is the one that mostly the children enroll in, and followed by inclusive education and then special education. And I also provide you with a comparison of 10 years data, was 2010, 2020. So there is an increment, a drastic one you can see from the integrated program and inclusive program, but not the special education. So these 2 are more towards the inclusive ideas, whereby inclusive education is for children who study in the same mainstream classroom, but then in the integration program, there are specialist class in the mainstream school. So there's kind of a mixture there. Right, so that was for the general disabilities. But for students with hearing impairment, this is the data in 2020. You can see as the integration program still comprised of the highest, and followed by inclusive education and then special education. So if we look at the percentage, 33% of the children with hearing impairment enroll in the inclusive education at the in 2020, and followed by integration and special education. So that means 1 in 3 children with hearing impairment study in inclusive education. All right, and this is a distribution of the age of the students who enroll in the public school. The students with hearing impairment mostly are in primary and secondary school, very little in the preschool. So if you want to look at the perspective of inclusive education in Malaysia, I split it into 4: audiologist perspective, teacher's perspective, deaf students' perspective, parents' perspective. So let's go to the first one. Audiologist perspective. Audiologists always believe that early intervention has direct causal effect on the academic outcomes of children with hearing impairment. Their achievements have no doubt relating to themselves, family backgrounds, and experience at the school. So to put it in a short forms kind of diagram, with early intervention, with the conducive auditory learning environment, and with the appropriate hearing devices prescribed by the audiologist, we can expect good speech, auditory, good auditory, speech perception, language, and education level. So, which is quite a quality to go into mainstream education. So, of course, there are other factors also that predict a good outcome in speech and language. Younger age, longer duration use, higher non-verbal IQ, spoken language in the education program, better aided hearing threshold, and a regular auditory verbal therapy. That means always use hearing and speech rather than signing. So these are all the good predictors, including the phonological awareness to the reading achievement. This is very important for academic preparation. So with the advancement of hearing aids and cochlear implants and the advocacy of early hearing detection and intervention program, there's increasing number of children with hearing impairment enrolled in inclusive education in Malaysia. So for the data of 2018 to 2020, the increment is from the 29.5% to 32.5%, and I believe is still increasing. So that's all from the audiologist's perspective. Next one is about teachers' perspective. Generally, regardless of the disabilities, teachers are positive towards inclusive education in Malaysia. And from another study that focused on the group of students with hearing impairment, teachers also very positive in terms of the inclusive education program. So a survey from 30 mainstream teachers in the school who has integrated program, the special classes in the mainstream school for students with hearing impairment, they are able to apply this program to students in their regular class, and they are all very positive about it. Other than that, they are interested to know how the next step, also how to implement inclusive education in schools and improve the collaboration between the parents and the school community. However, there are still a few recommendations that given by the teachers under the survey, that they mentioned that modification on the existing curriculum to suit students with inclusive education is needed. They also suggest that they need exposure, they need training, and then mainstream teachers although should know sign language. And last one is about teaching and learning methods should be in variation to facilitate students with hearing impairment in a class. Okay, that's perspective from teachers. What about from the deaf students' experience? So far, there are not many data regarding their experiences, in Malaysia. So there's interviews from experienced adults with hearing impairment. They have experienced the primary, secondary, and tertiary school in Malaysia. These are just some comments that I captured from that. They comment that they have inability to keep up and excluded from communication in inclusive setting. But then they're also happy that the opportunity to interact with people from diverse backgrounds at the university has developed self-confidence. So that helps them in the working life. Okay, some also, because they experience in the inclusive education and the integration program, some felt like they are more connected, more supported at an ease of learning in a deaf classroom. So I would say it depends on the auditory capability and spoken language and how are they ready for the mainstream setting as well. So one recent studies highlight the specific barriers faced by deaf children in achieving their educational potential. First is the little understanding about importance of good quality acoustic environment in Malaysia schools. This is relevant to audiologists, whereby we are the one that prescribe the hearing aids. Also, this is more about the room acoustic, how to reduce the background noise in the classroom. Second, educationists, teachers do not have relevant training or responsibility to maintain the assistive technology like the FM system, the hearing aids that we provide to the school. Other barriers are inflexibility of the education system is more exam oriented, limited to home school communication. Are these some factors that are constraining efforts to promote the participation in learning? Okay, that's from the teachers. Let's move on to the parents' perspective. Parents plays a crucial role in advocating for their deaf children's social, emotional, and language to learn, and not just for their education. So research have shown that in children with hearing impairment, high levels of parental involvement and greater time spent with children reading is significantly predict academic success. So for parents from parents' perspective, the emotion is identified as the biggest challenge faced by the parents in processing the diagnosis of hearing loss for their children. That means when they first know that their child have hearing impairment, and then going through the intervention and going to the school. In short, inclusion is not just about moving individuals with hearing impairment from one type of classroom to another. Social and their cultural inclusion in the family and to the society is also important. So where are we now? Malaysia is still at the initial stage of the development of an inclusive and equitable education system for children with hearing impairment. We are moving towards having them 75% of children with special needs to be enrolled in inclusive education programs by 2025. That includes students with hearing impairments. And with that, I thank you for listening.
Thank you for the enlightening speech, Madam Alshuli. As of now, let's continue to Q&A session. So the questions that are given by the audience, pada pendapat Puan, apa yang boleh audiologis buat bagi memudahkan murid yang bermasalah pendengaran mendaftar di sekolah arus perdana atau belajar bersama kanak-kanak yang berpendengaran normal?
Thank you, Chairperson. Can you hear me?
Yes, Madam.
All right. Sorry for my weird voice. I'm actually under house surveillance order. So if you can't hear me well, let me know, yeah? Okay. So should I answer in Malay or English?
Whichever comfortable for you, Madam.
Just quickly, let's see. All right, for your question is about nutrition. Can you repeat the question? Sorry.
Pada pendapat Puan,
Yep.
Apa yang boleh audiologis buat bagi memudahkan murid yang bermasalah pendengaran mendaftar di sekolah arus perdana ataupun yang untuk belajar bersama kanak-kanak yang berpendengaran normal? Peranan audiologis itu.
Yes, our audiologist roles in the enrollment and also how to support them in school. All right, so in that sense, actually for them to study inclusive education, if you can see from the slides and also the explanation from Dr. Wan Najiba, there's a lot and a long-term process. So to let them study in inclusive education. So I would say lots of factors, but we can do on our part in helping them towards that. So there are two issues there. One is enrollment to the inclusive school that would be on at around 7 years old, and support them, whoever in the school, that would be primary, preschool, or secondary school. So what I can say is that, as I explained in the slide, we started with very young age. Okay, so we will focus on early intervention, early diagnosis. As an audiologist, we do our part in that sense. And also when they are going to school, before that, sorry. So when we diagnose early, we give intervention. So we do it consistently and with all the package there, as I showing the slides also, we can expect some good outcomes there. Of course, we cannot say 100%. Okay, while they are in the school, we can support them in the sense like always collaborate with the teachers, and you can see that teachers are always in the data say that they don't have enough training and all that. Perhaps you need to, as an audiologist, if you have patients with hearing impairment, perhaps we need to collaborate more, correspondence more, discuss more to support them at the school level. Okay, I think we are doing our job, but I think more consistently and more alert about their performance at school and how to help the teachers. For now, I think that's all from me. Yeah, thank you.
Thank you, Madam Au, for the answer. So it's worth to mention that all of us had learned new things from the talk from Madam Au. So thank you again, Madam Au Chile.
Thank you.
Next, I would like to invite our last speaker, Dr. Muhammad Fazil Noor, to deliver a talk on teleaudiology approach in Malaysia, lesson learned. He is an audiologist at the Audiology Program, School of Health Sciences, University Science Malaysia, USM. He received a Bachelor of Audiology with honours from University Kebangsaan Malaysia in 2008. Following his bachelor's completion, Fazil Noor took a position as a clinical audiologist at Subang Jaya Medical Centre and Best Hearing Aid Centre, KL. Then he joined USM as a clinician in 2008. He supervised various aspects of clinical audiology for undergraduate audiology students. He was also involved with undergraduate final year research projects focused on educational audiology, hearing amplification technologies, and newborn hearing screening. Therefore, in 2017, he developed his interest and furthered his Master of Health Science in Hearing and Speech at UKM. After 1 year and a half, his application to upgrade his study from Master to PhD was approved. Soon after obtaining his PhD in 2010, his research interests are primarily related to telehealth in audiology, especially in hearing diagnosis among deaf and hard of hearing children. He is also looking forward to a strong collaboration with universities, the Ministry of Health, Education, Engineering and medical experts, and others. Currently, Fazil Noor maintains as a clinician and supervising undergraduate audiology students. Kindly enjoy his sharing session about his PhD journey and teleaudiology approach in Malaysia. Don't forget to ask after the session.
Okay, Assalamualaikum and very good afternoon to all. I'm Muhammad Fazil Noor bin Rashid, Senior Audiologist, Program Audiology, School of Health Sciences, University Science Malaysia. Okay, first of all, thank you for inviting me for this event for World Hearing Day 2022. Basically focusing on hearing care across the lifespans and education, Malaysia and Indonesia perspective. Actually, this is the first event that collaboration between University Science Malaysia, Universitas Gajah Mada, and then University Pendidikan Sultan Idris. Okay, for my presentation today, actually it's not like giving a lecture, it's more like sharing sessions about the teleaudiology approach in Malaysia and lesson learned. For the first, this is the next is the slide. As you can see from the slide, these are the main contents of my presentation today. First, I will explain or I will discuss about the introduction of telehealth, including the history, the terminologies, and then the Malaysian telemedicine blueprint. And then the second part, I will discuss about the introduction of teleaudiology, including the definition of teleaudiology, the type of delivery, the categories, and the benefit and the challenges of teleaudiology. And the third section will be the developments of teleaudiology services, including teleaudiologist model, level of implementation of teleaudiology, and then how the critical step to develop teleaudiology services. And then the fourth one will be teleaudiology experience, my own experience with teleaudiology approach. Okay, this part also I include the audiologist perception, especially in Malaysia, and then how we conduct teleaudiology services in special education service center. And then I also relate the audiology and COVID-19. And then the last one, our own experience in University Science Malaysia. Okay, for the first part, it will be the introduction of telehealth. Okay, this is the history of the telehealth, the advance of telehealth. As you can see from the slide, the teleaudiology begin with the telegraph and telephone, right? Okay, then the radio transmissions the radio transmission has been used by the doctors to treat and counseling the sailors during medical emergencies at sea. Okay, next will be the TV and satellite communication. Actually, this is the birth of modern telehealth. And then, for example, during this time, University of Nebraska had applied this approach to transmit information about the neurological assessment to their students. Then the NASA also used the satellite communication to monitor the health status of their astronaut. And then for the satellite communication, basically have been used to conduct or to implement the telehealth application or telehealth services in rural area. So they use the concept of satellite communications. And next, the hospital Veteran Affairs in US have been play an important role for telehealth because they have done a lot of research, some of them using a pilot study focusing on telemedicine. And then next will be the advancement of software and teleconference. Basically, for example, for today's presentation, we have conduct our event online between Malaysia and Indonesia. So this is the example that we have done telehealth, or sometimes we call it continuous education between Malaysia and Indonesia. Sometimes we can between a hospital and a university. Okay, it's a Malaysian telemedicine blueprint. Basically, this blueprint has been published or established in July 1997 by Ministry of Health Malaysia. Okay, as you can see from this picture, for the objective of this blueprint is to focus of the future healthcare system that will be on people and services while using the technology as the key enabler to provide an accessible, integrated, high quality and affordable healthcare system. Okay, as you can see from the picture inside my slide here, you can see that all the healthcare providers, universities, public institutions, healthcare consumer, healthcare suppliers and healthcare financing have been connected each others using the multimedia platforms. I would like to emphasize the involvement, the university involvement in this blueprint. As you can see from this one, there is a mention about the researcher, the student, and the faculty should involve with this telemedicine blueprints. Okay, one of the inside this blueprint, they also mention, they also explain what the current issue with the current issue in healthcare services. They also emphasize how to overcome all the issues inside all the issues in healthcare services. So that's why they have proposed the telemedicine blueprint. Okay, for the second part is the introduction of teleaudiology. Okay, basically, so this slide I just mentioned about the definition of the teleaudiology. Generally, the merging between internet and audiologists, it can give an opportunity to audiologists to explain or to expose their uniqueness in professional expertise, meaning that we can use the internet and the audiologists to reveal our potential services. So in general, the teleaudiology refers to the technology for providing audiological services and information to clients using ICT applications. That means anything that we have done to our patient to dealing with the audiological information for hearing assessment, for consultation, we can consider as a teleaudiology approach. In the audiology field, the term teleaudiology was often used in research paper an article to avoid confusion and straightforward terminology, because sometimes some of the telehealth they use a different terminology. So that's why in my presentation I use teleaudiology, so the person, the stakeholder, the patient will know better about the teleaudiology. Okay, next, this is the type of delivery of a teleaudiology approach. Usually we can divide this type of delivery into 3 types. First one is synchronous, the second one is asynchronous, and then the third one is a hybrid. Okay, for the synchronous, it's an interactive session between audiologists and the client using a video or video connection in real time. Some people say that this is like a live streaming, so we call it a synchronous teleaudiology. Meanwhile, for asynchronous approach is a store and forward approach, where the related data or image was sent to an audiologist for interpretation and consultations. Okay, actually this one also happened at the special education center, because some of them is not familiar with the sum result or whatever. They just snap the picture, then they ask us how to interpret the result, what is the best management for this patient. This one we call it asynchronous method. And then the hybrid is the combinations between these two approaches. Okay, this is the categories of the teleaudiology services. I believe that previously Dr. Wan Najibah already explains how we conduct the hearing test, how we do the screening process, how we perform the diagnostic test to interpret the hearing status, right? So similar with the teleaudiology approach, we also divide the teleaudiology approach basically into 3 types or 3 classifications. For example, for screening, for diagnostic, for interventions. And as you can see inside my slide, I also include the perception. Basically, the perception is more for research purpose. It's not related to the teleaudiology services. Okay. For example, for screening, previous study have done a screening for newborn hearing screening. That one we do hearing screening for the second screening. That means for the first screening have been done in the hospital, but for the follow-up, the parents just go to the go to the district hospital to do the hearing screening, but the audiologist monitor from the hospital. Okay, the second one is the diagnostic for hearing and balance assessment and also the tinnitus. But usually for the tinnitus, they use a teleconsultation, how to consult the patients who had a ringing in the ear. Okay, and then some of them also we can also do hearing teleaudiology for hearing amplifications. Okay. This the benefit and the challenges. Basically, all this is based on my literature, based on my reading, and also based on my own experience. Okay, first on the left side is the benefit of the teleaudiology. First, reduce travel time. Sometimes for the audiologists and then for the client. For example, some audiologists need to travel interstate, need to travel to another state to get to see their patient. So automatically we can reduce the traveling time for patient and also for audiologists. For example, I just give an example for my patient. Actually, the distance my hospital, my clinic to their home is around 3 hours driving, right? So I already advised him to just go to the district hospital and get the treatment over there. But the patient refused to get to that hospital. So maybe that one is before the teleaudiology. So later on, maybe we can connect our hospital to the district hospital that can get similar treatment, similar consultations. So the patient no need to come here for 3 hours driving, right? Okay, the second one is to reduce the cost of traveling. Okay, for sure, some of the patient, for the petrol, maybe some of the patient using the public transport to come to hospital. So sometimes we can connect near to the general hospital. Sometimes we can connect our clinic we can link our clinic to their house. And then the third one is the increased client access to services. For sure, sometimes patients no need to come here, but from the house they also can get the treatment, can consultation from us. And then also via the teleology approach, we also can develop, we can perform a medium for health professional collaboration. For example, for today's session, maybe later on we can build a professional collaborations between University Sains Malaysia and then Universitas Gajah Mada, right? And also we can involve the UPSI, Universiti Pendidikan Sultan Idris. And then the challenges that we have found during our experience, during my sessions. First, the most challenges that we meet is a reliable ICT infrastructure and IT support. So that's mean we need a good infrastructure for IT and IT support, a continuous IT support. Because sometimes during the test, before the test, ICT or the internet connection will be good, the stable internet connection, everything is good. But sometimes during the testing, we had with the internet connections, with the okay, next, the user must be patients is suitable for a teleology approach. For example, for the elderly, they're having a problem with the technology. Sometimes they're having problem to use the technology using their handphone, using teleconference. So that's why some people suitable for teleology, but some people is not suitable for teleaudiology. And then the third one is we need a portable and PC-based equipment, whether for our clinic and then for the remote area. Okay, this is the third one, is the development of teleaudiology services. Okay, this is the teleaudiologist model. Basically, this teleaudiology model was developed by Krum 2004. They divide the teleaudiology into 3 components. Actually, I have used this model to develop our own clinic setup, teleaudiology setup in our clinic. So they divided into 3 components. For the first component, we need to see the input. We need to get input and planning for the teleaudiology. That means we need to get input from the audiologist, from the patient, to get their willingness to participate in teleaudiology. And then the second part is a teleaudiology services. So we need to select whether we want to do a screening, diagnostic, or rehab. And then the component 3 is they propose the traditional visit, which is face-to-face. As I mentioned earlier, that not all patients is suitable for the teleaudiology, because some cases we need to see them face-to-face, right? So that's why for the third component, they also suggest we need to decide the criteria that patient need a face-to-face treatment. Okay, this is the level of implementations of teleaudiology. This one is suggested by Bala Chanda. Okay, he divide into 3 levels. For the first level, as you can see from my slide, for the first level is hearing aid troubleshooting from the main location to the remote clinic. For sure, hearing aid application or hearing aid troubleshooting is more easier, can be conducted using teleaudiology, because the less device, some of the current features of the hearing aid, they already they already install inside the hearing aid the features for the teleaudiology approach. So we just connecting the hearing aid. For example, we just connecting the hearing aid using our headphone, and then we save the hearing aid setting into the cloud and then transfer back to the patient hearing aids. And then the second level, focusing on hearing screening or diagnostic testing, and also for hearing aid recommendation or fitting. Or that means it's a combination between hearing assessment and hearing aid for intervention or rehab. And again, the third level is a complete audiological assessment, including hearing assessment, hearing care practice, and follow-up. So everything we need to do completely using teleaudiology approach. So that's why if we interested to plan for this teleaudiology approach, maybe we can start with the hearing aid troubleshooting first. Okay. this is the critical step that I think is more important to how to establish the teleaudiology in our clinic or in our private center. Okay, for example, the ICT facilities, we need a high-speed internet. For example, the PC, we need a high resolution of camera and the license. Okay, the second one is the collaborations. For this part, I would like to emphasize the engineering collaborations. For example, we need an engineer to develop a high-tech technology van that all the equipment audiology will be put inside the vans, and then we can move the van to a remote area, to the rural area, but the audiologists, the clinicians stay at the hospital. That means the driver will go to the rural area, bring our equipments, and then the testing will be conducted by the clinician at the hospital. And the third one is the training. Training is very important. How it's not only for the facilitator, but the training also should involve the audiologist, because not all audiologists are familiar with the teleaudiology approach. We also need to train how to conduct the test, everything. That's why some of the researchers had developed a simulator for the teleaudiology for training purposes. Okay, this is the last chapter, the last section of my presentation actually. This is my own teleaudiology experience in Malaysia. Okay, first, this is my PhD journey. We have done audiologist perception. We would like to know the willingness of our audiology in Malaysia. Okay. Basically, this study only involved 43 audiologists around Malaysia, and then some of them is from government sectors and some of them is private sectors. And then what we have found that approximately half of the respondents indicates that teleaudiology will have a positive effect on quality of care, accessibility and professional practice. And it depends on the type of group, type of the patients, and then type of clinical services. Okay. This is the example what we have done, teleaudiology approach in special education service center. Okay, as you can see from the slide, we divide basically the teleaudiology should have a testing center and control center. In my case, the 3 PK Selangor, basically 3 PK Selangor is a Special Education Service Center Selangor, have been linked to the UKM, Universiti Kebangsaan Malaysia, and then to Putrajaya, to Pulau Pinang, to Melaka and Pahang. The longest distance between Selangor is Pulau Pinang, is nearly 300 plus kilometer. Okay, so during this time, testing center, for the testing center, all the subject, all the educational audiologists will be seated at the testing center, and all the equipment will also will be located at the testing center. But the researcher or audiologist can stay at control center. For this study, we develop, we investigate the validation and the test-retest reliability. So basically, this teleaudiology approach showed a high validations and high test-retest reliability. Okay, how the audiology and COVID-19 had impact the audiology services. I think all people know, all of us already know that COVID-19 was officially declared a pandemic by WHO in February 2020, right? So this situation have huge impact all around the world, right? Including Malaysia and Indonesia also. So for the Malaysian government had announced an initial movement restriction order. At this time, the government also emphasized about the work from homes, new norms, and then the SOP, right? But for the healthcare services, for sure, the healthcare services have badly impact, right? So, but however, the positive thing regarding the COVID-19, the use of ICT in healthcare is rapidly evolving. So as a university, we take this challenge to maximize the ICT in our clinical training. Especially, we have adapt teleaudiology services, teleaudiology approach into our clinical training, especially for our graduates, undergraduate students. Okay, this is an example. This is an example what we have done in USM. This is the trial version of the teleaudiology in audiology clinic USM. This example we have conduct. During this time, my students, some of my students observed from their hostel, and we have done a pediatric hearing test. This is a play audiometry. As you can see for the first picture, this is the audiometer, and then the second picture with the video otoscopic examinations. Okay, so basically for this hearing test was conducted by my students, and then observed by my student at their hostel. Actually, why we have done this trial version of the technology, because we interested to see whether if the student observe from their house, is there any problem, especially for the internet connection, audio-visual communication, and then time by time we have realized that some of the students mentioned that the visual quality, actually the visual is very good, but the problem is the sound system. So that's why we buy a new microphone, that's a boom microphones. So that means the communication between my student to the patient can be heard from the student at their hostel. Okay, this is the second example what we have done after the trial version was successful. So we have done a clinical supervision using teleaudiology approach. Okay, during this time, all the students were not allowed to enter our clinic due to COVID-19. Okay, as you can see for the first picture, this is the hearing trial version, hearing trial session. My student inside the PC, and then I'm as a clinician and also act as a facilitator or assistant, and then my patients. So starting for the hearing trial session, starting from the key in the audiogram into the computer, into the NOVA system, all conducted by my students. But as a supervisor and also as a facilitator, I assist my student to put the hearing aids on the patients, and then I just follow the instruction from my students. But for sure, as a supervisor, if there is a problem, if there any recommendation that needed, then we explain to the patient, then I will ask my student to do some adjustment or whatever. And then for sure, during this time, we get the permission from the patients we mention to the patient that we will record the sessions, and then some of the students will observe the sessions. And then for the second picture here, we have done, I had supervised my student how they perform pure tone audiometry, the hearing assessment, right? So that's why I just observe via the laptop, so I can see each step of my student performing the pure tone audiometry. But for example, to check the tympanometry, we just put, I help the student for putting the probe inside the earphone to check the middle ear status. But all the interpretations, all the feedback session will be conducted by my student. And after they finish the session, we also doing a discussions with my students. Okay, I think that's all for today. Just enjoy my simple video here. Yeah. Okay, thank you. That's all.
Thank you, Dr. Fazil, for a very thorough and informative talk on teleaudiology approach, specifically in Malaysia. So there will be a question waiting to be answered. So this is from an audience. Hello, Dr. Fazil. We appreciate your enlightening presentation. I only had one question. So we are interested in utilizing teleaudiology to connect audiology service throughout Indonesia and Malaysia. So what aspects of teleaudiology should we evaluate before we start to use this teleaudiology? Can you answer?
Okay, thank you, Shahira. Thank you for Thank you for sharing the questions. Okay, I think I need to remove my mask lah, more clearer, right? Okay. Basically, good question. So one of the participants interested to build or to create teleaudiology approach between maybe throughout the Indonesia, as we know that Indonesia will be larger than Malaysia, right? So maybe they have a lot of hospital, a school, and then the private center. So the most important thing that I realized that what we need to do, or we need to assess the requirement, or the first. If we go back to our teleaudiology model, there will be a three component, right? As I explained earlier. First component will be we need to check the willingness, the willingness of the audiologists, willingness of the patients, and then sometimes we need to get some information about the ICT, right? So that's the first step. We need to assess everything. Sometimes we too eager to do the teleaudiology, but sometimes the facilities, the audiologists, and the patient is not ready yet. Right? So that's why in my study we need to conduct a survey first, right? And then the second one, we also sometimes we can use for the we call it teleaudiology acceptance model. That one we also need to assess the readiness of the patient, everything. And then the second step, or the second component, will be the what type of delivery. So we need to set whether we interested to perform teleaudiology for screening, or for diagnostic, or for rehab, right? So that's why we need to decide which one is the most important. Like I said before, one of the study, they focus on the hearing screening. For the first screening, they conduct in the hospital, but for the second screening, the teleaudiology van go to the district hospital or district rural area. So the patient just need to go to that center, or need to go to that van, and then the hearing assessment was conducted from distance from audiologist at the general hospital. That is one idea, right? Okay, the third one, the third component, basically, we also need to set the criteria for face-to-face treatment, right? So that's why I mentioned earlier, not all patients are suitable for teleaudiology approach or services. So that's why sometimes we need to set the criteria. For example, very small kid or very elderly or whatever. So we need to decide the criteria of the teleaudiology that need a face-to-face treatment or hearing assessment. I think that's all, Shahira. Is it clear, Shahira?
Clear, Doctor.
Okay, good.
Thank you, Dr. Fazil, for answering this question. And by that marks the end of the evening session for room 1. So as everything that starts have its ending, we will get back to the main conference room for the closing ceremony. A gentle reminder before we start the closing ceremony, participants for today's talk are eligible to get e-certificates. You can click the links provided in the chat room or scan the QR code provided later to fill out form in order to get e-certificates. Thank you. Participants may leave the breakout room. So for participants who joined us through the YouTube link, so you can go back to the original YouTube video.
Hi, I'm Angeline and I'm 25 years old this year. I am a tax accountant and I received my cochlear implant when I was 4 years old. When I first learned about Kenzo 2, I was looking forward to the off-the-ear wearing option and direct streaming features. When I work from home and need to attend the meetings virtually, the direct streaming features enable me to hear my colleagues clearly and I was able to engage and participate better. I also love the fact that I can now take calls seamlessly with Kenzo 2. It makes communication with my loved ones at home and overseas so much easier. I also enjoy listening to music through my phone now. This was not possible before and it was mind-blowing. A key highlight of Kenzo 2 was that it hides well under my hair. As a child, I was always conscious about how others see me with my sound processor, and I use all means to hide it under my hair. With Kenzo 2, I can now easily tie my hair up in a ponytail, and it definitely boosts my confidence.
Today, at the dawn of a new day, 1 in 5 live on less than $1 a day. Where clean water is scarce, where healthcare is limited, where even one meal is hard to find, a brighter future can seem an impossible dream. But we can make a difference to the things that matter. Today, I will make a difference. Today, I will nurture them. Today, I will transform them in their everyday, every song, every life, every dream, and every seed of hope. For them, their children, and their children's children. A brighter tomorrow awaits. Through the power of our commitment, today we will make a difference.
The existence of University Pendidikan Sultan Idris, UPSI, is today a symbol of evolution for the world of education in Malaysia. University Pendidikan Sultan Idris began as Sultan Idris Training College in year 1922 and it continues to stride. In year 1997, it became University Pendidikan Sultan Idris. The vision of University Pendidikan Sultan Idris is to be a prestigious university providing exceptional leadership in education based on the advantage of broad experience and high level of competency in meeting global changes. University Pendidikan Sultan Idris has a mission to generate and foster knowledge through teaching, research, publication, consultancy, and community services to achieve the vision of the nation. Rapid developments in University Pendidikan Sultan Idris have taken place with the establishment of a new campus, Sultan Azlan Shah Campus at Proton City. With With a size of 300 acres, the campus is able to accommodate more than 6,000 students at a time. In addition to the conducive learning environment, University Pendidikan Sultan Idris has set up student-friendly facilities that meet students' needs. Today, University Pendidikan Sultan Idris offers nearly 300 courses at various levels, ranging from diploma to doctoral levels. University Pendidikan Sultan Idris is determined to make research as one of its core business. Through research grants from various parties, continuous efforts are being made to obtain new findings as well as new products. Based on the expertise and dedication of its academic members, University Pendidikan Sultan Idris has achieved recognition at the national and international level. Internationalization has been actively implemented through memorandums of understanding, academic visits, and sharing of expertise with international counterparts consistent with the goal of becoming a leading education university in Asia by the year 2020. University Pendidikan Sultan Idris is also determined to create holistic individuals who are physically, spiritually, and intellectually balanced. To this end, a variety of programs that promotes personal growth and development are being offered to students. University Pendidikan Sultan Idris will continue to strive for success, to face diverse challenges, and to take the responsibility of continuing its historical glory in its quest to excel in the world of education in the interests of the nation. University Pendidikan Sultan Idris, committed
clearly, and I was able to engage and participate better. I also love the fact that I can now take calls seamlessly with Kenzo too. It makes communication with my loved ones at home and overseas so much easier. I also enjoy listening to music through my phone now. This was not possible before, and it was mind-blowing. A key highlight of Kenzo too was that it hides well under my hair. As a child, I was always conscious about how others see me with my sound processor, and I use all means to hide it under my hair. With Kenzo 2, I can now easily tie my hair up in a ponytail, and it definitely boosts my confidence.
Assalamualaikum and a very good afternoon to all. Kindly I remind again for all who to fill in the feedback form and e-certificate given at the live chat. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, we have come to the final part of the ceremony, the closing session. For the closing session, with honor, I would like to invite Professor Dr. Shahrum Samsudin, Acting Campus Director of USM, to give his speech. Without further ado, please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh and good day. Yang berbahagia Profesor Datuk Dr. Faisal Rafiq Muhammad Adikan, Vice Chancellor University Sains Malaysia. Yang berusaha Profesor Dr. Abdul Talib Hashim, Dean Faculty of Human Development, Universiti Pendidikan Sultan Idris. Yang berusaha Dr. Wenti Marina Minza, Vice Dean Research, Community Service and Cooperation, Faculty of Psychology, Universiti Gajah Mada, Indonesia. Yang berusaha Profesor Dr. Wan Rosli Wan Ishak, Dean School of Health Sciences, Universiti Sains Malaysia. Yang berusaha Associate Professor Dr. Muhammad Normani Zakaria, Chairperson, Audiology Program, Coordinator, Audiology Speech Pathology Unit, Universiti Sains Malaysia. Committee members of World Hearing Day, ladies and gentlemen. Syukur Alhamdulillah, praise to Allah Subhanahu wa Ta'ala for His grace and enabling us to participate in the World Hearing Day 2022. The collaboration of Universiti Sains Malaysia, Universiti Gajah Mada and Universiti Pendidikan Sultan Idris, we appreciate all the distinguished speakers who discussed about hearing care across lifespan and education, particularly for children. I believe that today's program enables all the participants to gain a better understanding of hearing healthcare and inclusive education for children with hearing impairment. It takes great effort to bring all professionals together to share experiences, knowledge and evidence-based practices in the hearing and education for children with hearing impairment. In the past, education for children with health impairment focused on providing sign language and cute speech. Families resisted enrolling their children in formal school, indirectly thinking that our system was incapable of supporting their education and developmental needs. Through this hearing awareness campaign, we hope to promote better hearing healthcare and implementation of effective procedures for accessing and managing those with hearing loss. In 2018, 29.5% of children with hearing impairment had been enrolled in inclusive education program by the Ministry of Education Malaysia and increased to 32.5% in 2020. This increment demonstrated that parents are more aware about hearing healthcare and try to ensure their children received the opportunities that are available for them. Apart from that, the universal newborn hearing screening has been implemented in Malaysia, including public hospitals and Hospital Universiti Sains Malaysia, to identify hearing problems at early age. Ladies and gentlemen, it is my hope that this program will enable strengthen existing relationships while fostering new collaborative towards improving hearing healthcare. Indeed, this program provides a useful platform to develop and engage the Malaysian and Indonesian communities. Last but not least, I would like to express my gratitude and congratulations to the working committee of this program, which includes members from Audiology Program and Audiology Unit, Universiti Sains Malaysia, Faculty of Psychology, Universitas Gajah Mada, Indonesia, and Faculty of Human Development, University Pendidikan Sultan Idris, Malaysia as well. All industry partners. Thank you for your kind presence. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi taala wabarakatuh.
Thank you, Professor Dr. Shahrum Samsudin, for the closing speech. With the end of the speech marks the end of our event for today, World Hearing Day 2022. Hearing care across the lifespan and education, Malaysia and Indonesia's perspective. Our deepest gratitude to all panelists for their overwhelming knowledge. We hope that in the future, there could be more collaborative events between universities across country. And last but not least, thank you to all participants for your time. Till we meet again. Buah nanas, buah ceri, dicampur gula, oh enak sekali. Cukup sekian pertemuan kali ini. Semoga ketemu di kemudian hari. Salam kami memimpin, salam pengetahuan suluh budiman, dan salam mengakar di lokal, dihargai dunia. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. The QR code for attendance and e-certificate will be shared on the screen right now.
Hi, I'm Angeline and I'm 25 years old this year. I am a CATS accountant and I received my cochlear implant when I was 4 years old. When I first learned about Kenzo 2, I was looking forward to the off-the-ear wearing option and direct streaming features. When I work from home and need to attend the meetings virtually, the direct streaming features enable me to hear my colleagues clearly, and I was able to engage and participate better. I also love the fact that I can now take calls seamlessly with Kenzo 2. It makes communication with my loved ones at home and overseas so much easier. I also enjoy listening to music through my phone now. This was not possible before, and it was mind-blowing. A key highlight of Kenzo 2 was that it hides well under my hair. As a child, I was always conscious about how others see me with my sound processor, and I use all means to hide it under my hair. With Kenzo 2, I can now easily tie my hair up in a ponytail, and it definitely boosts my confidence.